Well, here we are once again at that favorite place each issue for me, and I bet it is for you as well. That's our clinician and or researcher of the month component of the Functional Medicine Update. And I know I say this every issue, and I guess I must feel it, but it's certainly true this issue. You're in for an extraordinary treat this issue. We have a clinician who will bring his experience and his interest to you in ways that I think makes functional medicine stand up and be real. And, you know, sometimes I've been criticized, and I think justifiably so, for being a little bit up there in the blue sky, airy-fairy, idealistic, intellectual world of theory and take it down to the ground level of where the tires meet the road and where the mechanics really can deliver to patients improved outcome and quality of care. And that's going to be certainly fulfilled in my discussion with this month's Clinician of the Month, Dr. Alejandro Junger. And I think the name alone probably you already have some identification with. And if you follow at all the New York Times bestseller list, you're familiar with his book, Clean, the revolutionary program to restore the body's natural ability to heal itself. And there's so much more within this book other than just the program itself. There is a person behind the program and his philosophy and how he has brought in functional medicine into an interface with consumer and patient need and this remove, restore, rejuvenation type of approach. So, Dr. Junger, it's really a great privilege to have you as a guest for Functional Medicine Update and also to be in the studio. I consider that even a second tier, a real gift that you're giving us. So thanks for being with us.
Thank you. It's an honor to be here talking to you and just being here.
So let me start the story. I always start with this question, and that is through the many journeys that a person can be on in their life and the many different trails they could take, different pathways, you've selected a path that meets your particular background, interests, and needs, ultimately getting in somehow in this broad matrix that we call functional medicine. Tell us a little bit what your path was and how your journey took you here.
I went to medical school in Uruguay, in South America. When I graduated, I traveled to New York to do my internship residency in internal medicine, which I did at NYU Downtown Hospital in Manhattan. Then moved to Lenox Hill Hospital, also NYU affiliated at that time, to do my cardiology fellowship. The change in lifestyle from Uruguay to New York put me in a state, physical and mental and emotional state that was diseased. And looking for help, I consulted a gastroenterologist for digestive problems that were diagnosed as irritable bowel syndrome. Then I saw an allergist due to my severe allergies, which at times needed prednisone. And then I saw a psychiatrist for what was diagnosed as depression. And all in all, within 3 consultations, I was left with 7 prescription medications, which did not make sense to me. Now, I had a shock at that time, not only because I saw myself with a future of depending on drugs, but also because this is the type of medicine that I was practicing. So the shock was double. And at that point, I decided to stop everything and look for a different solution for my problems.
So that solution, I know, took you, and I think this is a point that differentiates to me individuals who finally get to functional medicine from those who have maybe similar thoughts but never get there. And that is, there's a point of action. And some people are afraid to pull the trigger or take the step or make the commitment. And people like you make a commitment. So your action took you where?
Well, some people say, how courageous of you. But the truth is, I had no option. I really literally was just looking to ease my disease. And one of the first things that I noticed was that my mind was constantly producing thoughts. And I say my mind was producing thoughts as opposed to saying I was thinking, because that's what I realized, that there was nobody there initiating those thoughts. In fact, if I had a choice, I wouldn't have been thinking 95% of the thoughts that were appearing in my mind. So my burning desire of an answer was, well, where are these thoughts coming from? Who is deciding them? How come I wake up in the morning and the check I have to pay and I remember this and that, and if I'm thinking of the things in the future, I become anxious, and if I'm thinking of things in the past, I become sad, and how these thoughts that are just appearing in my mind are playing my emotions like a symphony and with a life of its own. So that was my burning desire, to answer that question. Well, where are these thoughts coming from and who is producing them and how can I get rid of them? So I started studying everything that I could in terms of where thoughts come from. I used to go to the libraries and go to the psychiatry and psychology sections. And then I read and I underlined anything that made sense, that resonated, which took me to the references that I was finding were then from the New Age section. So I was shifting from the psychology and psychiatry section to the New Age section, then to the Eastern philosophy section. Finally found a book on meditation, which said basically that meditation was the way to slow down and even stop the thinking process. And I said, this is what I need. So I basically found a meditation teacher and ended up in a monastery in India trying to basically shut my mind.
So tell us a little bit about that. That must have been quite an interesting transformation from New York.
That was an incredible experience. I ended up directing a group of healthcare practitioners from modalities from all over the world. And I always say that without even ever hearing the term integrative medicine, I was directing a team of practitioners from different philosophies and modalities from all over the world. And this was my experience of integrative medicine.
So you're both in that capacity, I think, serving as a teacher and as a student simultaneously. So did you actually have, through that involvement, some relationship to patient care, or was this more just talking about where one should go?
Well, no. We were actually running a clinic in the ashram, in the monastery. We were seeing up to 2,000 people at any given time were living there from all over the world. And we were running the first aid station, the clinic. So we would get a patient, we would sit him in the middle, and all of us around asking questions, the Ayurvedic medicine doctor, the Chinese medicine doctor, the chiropractor, the hands-on healer. And then we will discuss how each one could contribute to the treatment of this patient with the best tools that we had without conflicting with each other. So at times, the Ayurvedic doctor prescribed a diet, and at times I had to take patients to the hospital in Bombay, which was 4 hours away, because there was, for example, a patient that was having severe bleeding, and the Ayurvedic doctor wanted to start him a certain diet, and I said, this is for later. Let's take this patient, let's cauterize that artery or vein that's bleeding, and then we'll start on a diet, you know.
As you did this must have been very interesting from a kind of a pedagogical or learning system basis, that what you were almost realizing is a different educational system from the top-down lecture series type of approach, didactics system of Western medicine, to kind of a participatory collaborative system. So it probably spoke to your mind and the thoughts you were having in a very different way, I would imagine.
Well, more than speaking to my mind, it cracked my mind open. Because one of the things that I base my life on is you cannot argue with success. And when you see that meditation is successful in treating a certain state, there's no argument there. So I learned from Chinese medicine some things that were very effective. I learned how needles and certain herbs work very powerfully. I learned how Ayurvedic doctors divide the doshas according to the constitution and how diet influences them powerfully. I learned how meditation has a place in achieving a state of well-being, and I couldn't deny it. So this was imprinted in me so powerfully that I still carry it on with me today.
So we're going to now jump forward for a second, then come back and fill in the gap. The jump forward is now I want the listener to be thinking, okay, we're now in an ashram in India. Dr. Junger is overseeing and collaborating with this group of integrative practitioners. And now we're going to segue real quickly, time feed forward to this very successful medical clinic that you and Dr. Lippman share in Manhattan, one of the most busy, energy-intensive, time-compressed centers in the universe, or at least in the known universe as it relates to the world. And in between those two resides your life. As they say, life is what happens in between our plans. So tell us a little bit about how you got to this extraordinarily thriving practice from the ashram.
Basically, my family is Jewish and from South America. Actually, my parents are both Holocaust survivors. So when I told them that I was going to an ashram, this is the golden boy, just graduated from cardiology training. He's now going to fulfill our dreams of achieving something in the world. And then suddenly I'm dropping in and going. They were desperate. So my father made me promise him that a year later I would meet him in New York and we would just recap. So then once I was in New York, I realized I needed to make some money to live. So I applied for work and I found a job in a very busy cardiology practice in Palm Springs. So I went back to practicing medicine. I said, well, I'm going to bring everything that I learned in the ashram, I'm going to bring it into my practice, which was an impossible thing to do because I realized that in order for me to be in competition, in order for me to be considered profitable as a partner in this practice, I had to see a certain quota of patients, which left me with about 7 to 10 minutes per patient. And 2 years into this, I was literally hating medicine again. And not only that, I was back to eating foods from a hospital cafeteria and back to being depressed, allergic, and with irritable bowels. So at that time, just by chance, a friend of mine had gone to a detox cleansing center, had an incredible experience. When I saw him 10 days, the last time I saw him was 10 days before, and in 10 days, he dropped like 15 pounds, he looked younger. I mean, it was such a transformation. I said, I have to learn what this guy did that put him in this state, because this is what I wanted to be able to cause on people when I went to medical school. So I went to this center called the We Care Center in Desert Hot Springs, near Palm Springs. I saw what other people were going through. I immediately signed up for the program, and in 14 days, basically, my allergies, my depression, and my irritable bowel syndrome completely disappeared. I was so blown away that I started going to this center and sending my friends, my family, then my patients. And then the owner of this center asked me to start lecturing there, or at least just sharing with the clients there what I was finding that could explain from a medical point of view the results that we were seeing. But it wasn't until I did my first AFMCP that I understood, that I was able to translate physiologically and biochemically what I was seeing. That was kind of miraculous in a way, because I didn't have the scientific language to explain it.
I know when a lot of doctors go through the course applying functional medicine in clinical practice, they have an aha or an epiphany experience, and it hits them at a level saying, well, this is actually why I went to medical school. This is what I thought I was going to be doing when I got out into practice. And then the translation of that and incorporation of it into their lives becomes the real challenge. It's like having a feel-good experience that you then have to return back to the real world. So what happened after AFMCP for you?
Well, for me, it was different. For me, the aha moment of this is what I wanted to do when I went to medical school came before. But the intellectual understanding of what it was that was happening to people when they were doing this was not there. That was the aha moment for me. Functional medicine and the AFMCP gave me the language, gave me the intellectual tools to understand the physiology behind what I was witnessing, which was kind of magical to me. So functional medicine gave me the translation, gave me the explanation of something. You know, when a magician explains the trick, it seems so easy, but when you see it for the first time, you're just blown away. This is what functional medicine did for me.
So from there, you and Dr. Lippman have developed an incredible repartee partnership, which is not always easy with very creative people who have a lot of sense as to what the universe should look like. Partnership can be the best of all worlds, and it can be challenging as well. But your clinic has just started to radiate goodness to patients of all types and dispositions and backgrounds. So tell us a little bit about what goes on for you in Manhattan.
Well, before I arrived to New York, I actually moved from Palm Springs, where I was practicing. I left my practice. Basically, I left 3 months before becoming a partner in a very busy practice with a very big promise of a monetary remuneration. And I actually went to We Care and became the medical director, which was basically none other than sitting under a tree with these people and talking about what I didn't know was functional medicine at that time, what I was trying to understand, how to integrate fasting, cleansing, and detoxification into a wellness plan, how to think of it in terms of not contradicting what their doctors were telling them. So then I moved to Los Angeles, kept on working at We Care, and met a Chinese medicine practitioner there, Dr. Drew Francis, who introduced me to functional medicine. And that was when the aha moment happened. I worked with Dr. Francis for a while and then was invited by Donna Karan to speak at her Urban Zen initiative. She's trying to change medicine in the United States after a very bad experience with her late husband who had lung cancer, and she wanted to give him other aspects of care that Western medicine is not providing in the hospital, and she was denied. Even with all her power and all her contacts, she was not able to give her husband the access to acupuncture and other modalities that would have made his demise easier, right? So she is on a crusade to change medicine. So she created this movement called the Urban Zen Movement, and she invited me through a patient that I have to speak at this convention or conference where Frank Lipman was one of the speakers. So after we heard each other speak, we became curious about each other. And so Frank came to me and basically asked me, "What's your name, Alejandro?" And he said, "I've been looking for a partner for 10 years, and I think it's you. And I know you live in Los Angeles, but you got to come and work with me." So I did. I sometimes compare this to a rookie playing basketball, and Michael Jordan comes and says, "You come and play with me." You're not going to say no. So that's what I felt like when Frank invited me to work with him. And what has happened is we work in offices next to each other, and we just basically run from room to room when he has a patient, and he comes and says, "Alex, listen, come in." And he pulls me in the room, and the patient has two opinions in one. And I do the same thing. I pull him into my room, and that's how we work in a very simple and interactive way that patients really like. That's a big part of the success that we've been seeing in the clinic. Not that Frank hasn't seen it before, because Frank was a very established practitioner way before he met me. But this is some of the things that are happening now with both of us in the clinic.
So I think it's interesting how circles work within circles and things come 360 and remorph themselves. So this Lenox hospital experience you had that was your residency in cardiology, it kind of remorphed in your life, it seems, now that you're back in practice. Tell us a little bit about Lenox Hospital.
Well, I did my fellowship in cardiology at Lenox Hill Hospital, and one of the attending physicians, which was one of my dearest professors or teachers there, was a doctor called Dr. Roni Shimoni. He's one of the cardiologists with the biggest heart that I know. And even though he practices Western medicine and in a very extreme way, because he really uses interventional cardiology a lot, angioplasties and angiograms, he gets results above the statistics of Western medicine because of his open heart, because he loves his patients, and because he's such a good man. So I had established a close friendship with him. And when I came back to New York 15 years later, we established contact, and through our interaction, he actually invited me to help him at the office one day a week, and basically was exposed to everything I'm doing with Frank that led him to be willing to start an integrative service at the department in Lenox Hill Hospital. So that's what we're working on right now. Basically, in my mind, is bringing functional medicine into the hospital, into Lenox Hill Hospital.
So there is a thread, obviously, that ties all this together that's fairly obvious to the listener. And that thread is you're a man of passion, you're a man of principle, you're a person that's directed by experience, you are guided by a series of deep objectives as to where you want your life to go, but you're not necessarily a guy that runs his life off a set of plans out of the 7 Ways to Be Successful or the motivational seminar series of the Month Club. Tell us a little bit about how that's worked for you.
Well, I wish that I could have gone when I was doing my fellowship and I was depressed and with irritable bowel syndrome. I wish I could have gone to a course and in 5 days resolve everything and make a plan for my life. But I had to actually do it the hard way. I was desperately looking for a solution for my problems. And that led me to find what I found, to find functional medicine. And because it helped me so much, first my friends and then my family and then my patients started to ask for it. So I had no choice. This is what organically happened to my practice, and I'm happy that it did.
I know for a lot of people who come in this field, they're very enthusiastic about it. They know that it resonates correctly with their sense of what they want to do, but often they don't know exactly how to structurally pound it into the model to make it a success financially or procedurally from a tactical point of view. Do you have any sense of guidance? Not that there is a master design, but just kind of what it is in your experience has led you into what it appears like escalating a success?
The only thing that I can say is that if you focus on results, if you focus on giving to your patients what is going to bring them to a better state, then that's really the formula that I use, because word of mouth spreads. People are looking for results, and when you have good results with patients, everything else happens on its own.
So I've been criticized over the years, and so I'll share this criticism with you. I'd like to offload some of it off my shoulders. The criticism is, Jeff, you've spoken for years and years, in my case now over 30 years, about this functional medicine concept, but you've been a little irresponsible in doing this because you don't have any long-term outcome studies to demonstrate that patients really will live longer or they're really better off than if they would have just stayed the course, stayed with the prescription, and done a traditional standard of care. So don't you think, Jeff, you're misleading people into thinking that this is the holy grail or they're going to get something that they wouldn't have gotten by just following what everybody else by board certification feels is the right path? What would be your response to a person who criticizes me for that?
Well, my response to that person would be, you should really take a look and see what those double-blind clinical placebo-controlled studies are done, how they're done, why they're done, who are they done with, how the meta-analysis is made, because there is this idea that science and Western medicine has the answer for everything and is the gold standard to compare things to. And if you really understand how those numbers are gotten and the many things that are omitted from these studies, then you would actually lean on to something like functional medicine to guide yourself from.
So now tell us a little bit about what you've seen in the patients that you've been applying this construct of clean and the functional medicine personalization. Give us kind of a Rorschach test as to how this looks to a patient that's gone through your program.
Well, I have so many stories, but I can think of a few that are really remarkable. Like, for example, I had this 28-year-old lady. She was an architect. She is an architect, and she came to me with a cough that was persistent for like 3 years. She had gone through several courses of antibiotics. She had even had a bronchoscopy with a biopsy taken. She went to every extreme and came to me as a final resource to deal with her problem. I put her on a detox program, on the clean program, and within 3 weeks, her cough had completely disappeared. But then she called me and she said, "Doctor, something really strange happened." And I said, "Well, what happened?" She said, "Well, I started really getting blurred vision, and I didn't really understand what was happening. So I went to my ophthalmologist, and basically what ended up happening was that she had worn glasses for the last 5 years. She didn't need glasses anymore. So her blurred vision was because her glasses were not needed anymore. So that was an incredible result. Then another one, this lady recently, 38-year-old, who came to me. She was sent by one of my celebrity clients, and she came to me and said, "Doctor, I come to you. I don't believe in what you do, but Western medicine, which is what I believe in, wants to give me chemotherapy." I said, "Well, what's the problem?" "I have something called Ankylosing Spondylitis, which is a autoimmune disease, and it's characterized by the finding of an anti-Ro antibody, right? And one of the things that I now understand is that the confusion of the immune system in attacking yourself many, many times is originated in your gut. Well, the leaky gut syndrome, which is not recognized by Western medicine." And basically, I put this lady through the program. She did really, really well. And then later on, we found that she had very, very high levels of mercury. And I started treating her with oral chelation. To make a long story short, not only did she avoid chemotherapy, but her anti-Ro basically turned negative. And her rheumatologist, which is one of the top rheumatologists in the United States, and I'm not going to name any names, basically sent her an email saying that she was committing suicide and that the doctor that was doing this to her should be put in jail and his license should be taken away. So we are going to frame the anti-Roe negative and we're going to send it to him. And she actually clinically looks incredibly much better. Her pains, which is what the Ankylosing Spondylitis, her hip pains have completely disappeared. And she's a new person.
You know, it's really fascinating, isn't it? It's hard for any of us to know what we don't know. We're told what we should know, but we're not told what we don't know. And I was very intrigued in the August issue of 2009 of Scientific American, which I would consider a fairly conservative science for the average person type journal. It had a wonderful article on gluten authored by Alessio Fasano, who is in pathology now at Maryland. He was at gastroenterology at University of North Carolina School of Medicine. Now he's in GI and pathology at Maryland. And he's, I think, considered one of the top experts in the world on celiac disease. And in that article, there's a fascinating diagram, as only Scientific American do with beautiful medical illustrations, color, of a leaky gut. And he's talking about the fact that once you have opened the portals of entry with gluten sensitivity, that many other middle molecular weight molecules can swim across the gut into the blood and have access to the immune system and can initiate systemic effects. And you know, so this thing that was so vehemently rejected for years as not factually correct is now starting to get traction because we don't know what we don't know until we start to know it.
Not only that, we often find what we look for, but we only look for what we know.
That's very well said.
So that's one of the big problems that we have, that Western medicine only looks at a certain spectrum of problems and has a way of detecting them, but they only look for what they know. That is where the confusion comes.
So in the few moments we have remaining, I'd like to ask just one last question, which I think could be very helpful for some of our listeners, and that is, as a person who's watching this field unfold, watching the national healthcare debates be raging, recognizing that we're in a demographic transition with aging baby boomers, knowing that we're in a global economic kind of meltdown and re-annealing with a new alloy probably coming out of this time into the 21st century, what's your view of medicine for your colleagues? What's your view of getting up every morning, putting your shoes and socks on and doing your work? And is there anything that you would pass on from your pathway that might be helpful for some of us who are still on our path?
Yeah. You know, people ask me, do you like your work? And I don't really consider my work and my life different. I wouldn't be doing anything else. When I'm not working, when I'm not in the office, I'm doing the same thing. So in a way, to find what you really, really like to do, to find what you really want to do is one of the most important things. And this is important because what I see is all my colleagues that are still trapped in the Western system, in the modern Western medical system, they actually hate their job. Many, many times they went into medicine with this idea, with these principles, and then finding this system that is in a way prostituted in competition and the politics inside the hospital, it degenerates the whole thing so much that they end up looking at their work as a job. They can't wait to get out of the hospital and they can't wait to sign off their beepers and get the hell out of there. I don't see that in my life anymore. Luckily, I consider myself so fortunate because since I wake up till I go to sleep, for me, life and work is the same thing. This is, I think, one of the most important things that one should look for. What is it that you really, really want to do? What is it that you really like to do? And then everything happens on its own.
And do you worry at all about losing touch with, quote, medicine? In other words, losing touch with all the skills that you developed, the bioscience, the hours that you spent developing certain types of understanding and knowledge?
Well, the thing is, if you get the textbook of functional medicine, you'll see that actually you will be much more versed in those things than if you go to medical school. But another aspect of that question is the whole aspect of how hospitals work and how these technologies can be used. And the thing is this, of the 100% of diseases that exist today, 10% are actually very, very well treated with Western medicine. If I'm having a heart attack, I ain't going to go to take any anti-inflammatory herbs or going to meditate. I'm going to the first cath lab that can open my artery and save my myocardium. Now, afterwards, then I'm going to meditate and I'm going to do the nutrigenomic aspect of switching my genes. But that 10% of acute problems are actually very well treated by Western medicine. There's nothing comparable to it. Now, the 90 other percent of diseases, which are the chronic diseases, that we are trying to force the Western medicine tools into solving, that's what we have to change. That's where functional medicine has a place and a role that's very, very important for us to bring in.
And how about the voices that were there that started you down this path that became the masters of your change? Have they changed?
Well, again, you can't argue with success. And when people see results, they start looking at you with more respect and with more interest. And actually, whenever you touch them in the personal life and you resolve any problems that they have or their family members have, then you have a convert. And that's what I'm doing. I'm just spreading the word and trying to help as many people as possible.
Well, I can't tell you how much I personally, and I think every listener appreciates this inspirational sharing. I mean, you went well above the normal reductionistic discussion that often pertains to bioscience and 21st century medicine. It's really the connections. It's really the sense of what is the principle, the purpose, and what is healing all about. Where does it come from? It comes from an intentionality that radiates from everything you talk about. I want to thank
and for me to be sitting here with you is really an honor and a coming of full circle, because you gave me the possibility of expressing myself and of understanding what I was witnessing as miraculous, as weird, and understanding that this is actually very, very well explained.
Mm-hmm. Well, thank you, Dr. Junger, and we look forward to seeing Clean just continue to do its job of cleaning and hearing of your success. And, of course, what a great partnership with Dr. Lippman. I can see the two of you really would be a force to reckon with. So thank you so much.
Thank you.
The best to you.
Thank you.
Well, once again, we really thank Dr. Junger for an extraordinary contribution to understanding really how this functional medicine model can apply successfully in managing patients and developing a very, very exciting and rewarding practice. Let me, if I can, talk a little bit about one of the aspects that has been on our radar screen for some time, probably the most well-understood, well-researched, and widely accepted nutritional intervention product within the armamentarium of our tools, and that is essential fatty acids. I'm reminded all the way back to what would have been probably the late 70s, early 80s with the Ames group in the New England area that was meeting with Dr. Donald Bruton and Dr. David Harobin early on. This would have been probably the late 70s to talk about the role that omega-3 fatty acid insufficiency had on increasing the relative risk to all sorts of health issues, including psychiatric disturbances, neurological disturbances, cardiovascular, immunological, inflammatory. This was back in the late 70s. And so how long does it take for medicine to change a light bulb? Well, in this case, we can say that, let's say it was 78, 79. So now we're 30 years downstream, and it's now become an aha for many people as they start to understand the role that omega-3 fatty acids play. But as with anything, a little is good and a whole lot more might not be better. In fact, a whole lot more might be not as good. This is the Tolman's law of pharmacology that says everything is toxic at some level. So with regard to omega-3 fatty acid, knowing that we have alpha-linolenic acid as the first member of the omega-3s, and then we have docosahexaenoic, and we've got icosapentaenoic acid, so that's DHA and EPA respectively. Which of these are the best, and what roles do they play, and what's the best dose response, and are there any adverse side effects? And, there's a lot of questions, certainly when we start supplementing or using therapeutic doses of these various substances that we need to properly address and answer. So one of the things that has recently been stated is that the supplementation with DHA results in increased levels of LDL cholesterol. I've heard that being expressed in a number of places. DHA, as you know, is found in very high levels in various marine algae. In fact, EPA and DHA is not really manufactured primarily by fish. It comes as a consequence of the fish consuming things within the food chain where the omega-3 fatty acids are already manufactured for them, and they get concentrated within their tissues as a consequence of them consuming foods that have it. And certain forms of marine algae have high levels of DHA. So if you start looking at algal vegetarian supplementation of humans with high levels of DHA, when I say high levels, I'm talking about something on the order of, say, 1.5 to 2 grams per day of DHA. That's a very high level of DHA specifically. And ask what is the effect that has on serum lipids. A paper was published in the Journal of Nutrition in which that intervention trial was done. And in this study, what they found is that the consumption of DHA capsules did increase DHA serum levels and phospholipid levels by 246%. And so it had a very remarkable effect in increasing DHA. It actually lowered the LDL to HDL ratio, and it also lowered serum triglyceride concentration. So this concept that DHA supplementation increases LDL, there may be those individuals who have a variant response, but at least in the case of use of algal form of DHA supplementation in humans, this study didn't find an elevation. They saw a reduction in LDL and improved LDL-HDL ratio. This was further confirmed in another interesting paper published in the American College of Nutrition Journal, looking at intervention in individuals who consumed up to 2.5 grams a day of DHA for 6 weeks, and found once again that triglycerides were significantly reduced and HDL was increased. So I think that we can say that there is generally a favorable trend towards cholesterol-HDL ratios and LDL-HDL ratios, as well as a lowered triglyceride level in people that are supplemented with fairly high doses of DHA and also its companion EPA. Hope that's some help in kind of making sense of this information with regard to fatty acid supplementation. I look forward to being with you next month.
Functional Medicine Update is copyrighted by Synthesis, LLC by Dr. Jeffrey Blank. Reproduction in any form is prohibited.